Alright, then let's begin for today's class. And I think no one is going to join today, so I'll be just finishing it fast. Today we have small topics. We have to finish the dermatology of musculoskeletal, and along with that, we'll be doing general farm. General farm, nothing to there is nothing much in there. Just few topics are there. That's all we'll cover today. Let's just start. All right, we were doing about the bone tumors and everything yesterday. Today we will do the skin part. We will start with the skin, finish with the skin. All right. Yeah. Okay. So that's it. Let's start. Now, see, before starting the skin, you should be able to remember these layers because they will be asking you this diagram or any diagram related to this, and everything is you need to remember. You need to remember in order which order the skin layers will be present, in which layer they will be absent, and everything you need to remember. So you know this mnemonic they've already given here. Come, let's get sunburn. Okay, so that is a very good mnemonic, and there are few lines I need you to remember. Stratum corneum, they have anucleated cells. Anucleated cells, keratin present. Okay. In stratum lucidum, there will be dead skin cells. In granulosum, keratohyalin granules. In stratum spinosum, desmosomes form spine. In stratum basalis, we have stem cells. Okay, and yeah, we need to know this. No blood vessels in epidermis. All right. So this is some information that you need to remember. They might give you either the name of the region, and then you have to figure out what are the features, or they might give you one of the features, and you have to figure out what they are talking about. Okay. Moving ahead, we have epithelial cell junction, and this is very important because they have asked a lot of question over here. Okay, don't ignore this part. At least you should be thorough with this image. Just remember the proteins and where the junctions are present. Okay, this is what they have given the written form over here. So just make sure you know each and every information here. Another thing, there is one question asked in you world. Yeah, gap junctions promote electrical activity. Okay, gap junctions promote electrical activity. I have to write again. No problem. रोहित this क्लास चल रही है बाद में आओ एक मिनट जस्ट अ मिनट ऑलराइट सॉरी फॉर द डिस्टर्बेंस सो या आई वाज सेइंग कि गैप जंक्शंस जो है गैप जंक्शंस प्रमोट electrical activity. This was the one of the question asked in UWorld. Gap junctions promote electrical activity. So prior to delivery, estrogen stimulates gap junction for myometrium excitability. For myometrium excitability. All right. So this was one of the question. Exactly information I have written as it was in the UL. I expect you to note this down so that UL का question आपका सही हो जाए. Okay. So don't worry. This is all you need to know. And yes, you have to know about the merocrine, apocrine, and holocrine secretion too. चलो एक बार ये देख लेते. Let's just see this for one. Tight junction, journal of. I don't know what the problem is. Going to the tight junction, Jonella occlusion prevents parallel. It is a tight junction. Okay, nothing will be exchanged over here. Adjacent junction, forms belt connecting acting cytoskeleton. Okay, not needed. Loss of E-cadherin promotes metastasis. This line is very important. Loss of E-cadherin promotes metastasis. Coming to desmosome, structural support via intermediate filament. Autoimmune bodies to desmoglein 1 is a disease that will be studying ahead. Pemphigus vulgaris. Gap junction. Channel proteins called connections. Connections are very important. Electrical and chemical communication between cells. Hemidesmosomes connect keratin in basal cell to underlying basement membrane. Autoantibodies, bullous pemphigoid. Okay, so pemphigus vulgaris and pemphigus bullous pemphigoid are the two important blistering disorders that we'll be studying ahead. Integrin, membrane proteins that maintain the integrity of basolateral membrane by binding to collagen, laminin, and fibronectin in basement membrane. Now see, this integrin and another thing that was important is Catherine. I don't know what the problem is occurring today. Just let's do 1 minute. I'll do it here only. For those who are watching the recording, please pause it over there and write down because I'll be continuing from the next page now. I'll just explain you what I was trying to explain. All right, it's not a problem. Okay, so skin layers we already did, and yeah, this all I was talking about. And yeah, one thing I was saying, this E-catering that it promotes metastasis, and the next one is integrin. They will ask you what is the role of integrins and E-catering. Okay, definitely they are going to ask you the role. So make sure you know the functions properly. Okay, moving on to the exocrine gland, I told you merocrine, apocrine, and holocrine secretion you need to know. Moving ahead now, see before moving towards the dermatology or before moving to the skin disorders and everything, I want you to know this properly. Ignore the examples is okay because it's difficult to remember, but at least know कि इनका मतलब क्या है. Okay, you should be knowing what is the meaning of all of them. They are not going to ask you the meaning in exam, but I want you to know so that you do it properly in the exam. Okay, so just remember the meanings and just give a look at these images कि इन सबका मतलब क्या है. Okay, so if in case you forget something in the exam, you can think about this and write, yeah, it is a papule, it is a macule, where is papule present, in which condition macule is present, and all those stuff. Okay, coming to this microscopic term, even this is very important. What is the meaning of dyskeratosis, hyperkeratosis, parakeratosis? Very important. Okay, so ये सब भी आपको आना चाहिए because in the question they will directly give you this term. Okay, terms के बाद आपको भी तो पता चलना चाहिए ना कि what they are saying. All right, so you should be thorough with the terms and just give a read at this example. आगे जाके तो we are going to see, but here this is the basics of the dermat. Just see this lesions and this some microscopic terms that you should be aware of while doing this. Okay, moving ahead, we have pigmented skin disorders. The first type of disorders that we'll be discussing is pigmented skin disorders. All of them are important. Let's just see. Normal melanocyte number with decrease in melanin production due to decrease in tyrosine kinase activity or defective tyrosine transport, increased risk of skin cancer. Now see one more thing. Similar to the musculoskeletal, here you have to pick out at least 1 or 2 points and you are good to go for a diagnosis. Okay. In the bones also we did the same thing. Just 1 or 2 lines and diagnosis ho gaya, and then based on the lab values and all those stuff you are able to make the diagnosis. Okay. So here also skin may be same thing. Hai. With some what happens is this part of the system skin sometimes they will be asking you with many other major disease. Okay, individually बहुत कम पूछते हैं, but yeah in step one as it is a totally detailed exam, so they might focus individually. So make sure you know each and every skin disorder properly. It's very easy to go, and entire musculoskeletal system is very easy system. Okay, इसमें आपका एक भी गलत नहीं होना चाहिए. All right. Now see, I told you this normal melanocyte number. Melanocyte number is normal over here. Melanin production is decreased, and why it is decreased because of decrease in tyrosinase activity. All right. Coming to second, melasma. Acquired hyperpigmentation associated with pregnancy. That is the mark of pregnancy or OCP use. They will definitely give you either pregnancy or OCP use, and this image is very viral. Okay, the image viral bhi hoga. You can see this mark over here. That is the because of pregnancy mark. Coming to the vitiligo, irregular patches of complete depigmentation caused by destruction of melanocyte. Okay, see this is what vitiligo is. Destruction of melanocyte. यहाँ पे normal melanocytes है. In albinism, melanocyte are normal, whereas in vitiligo, destruction of melanocyte. Okay, so don't confuse yourself. Another thing is just write it down. Freckles. What are freckles? So freckles are basically, small brown 10 macules, small brown 10 macules, darken on exposure to sun, increase in number of melanosomes or increase in melanin. Melanocytes are normal. Okay. So they have asked questions regarding the freckles. So these are the 4 points that you need to know. Another important. That's it. Okay, that's it. So freckles, vitiligo, albinism, melanocytes, normal किस में है, decrease किस में है, you should remember. Freckles में क्या हो रहा है? There is increased number of melanosomes. Okay, melanocytes are normal, melanosomes are increased. So look at each and every word that they are talking about. Okay, moving ahead, we have seborrheic dermatitis. It is different from seborrheic keratosis that we saw in the GIT cancer. Okay, दोनों अलग अलग चीज है. This is seborrheic dermatitis. Let's just see. Erythematous, well demarcated plaque with greasy yellow scales in areas reaching sebaceous glands, example scalp, face, and periocular region. Common in both infants and adults. Associated with Parkinson disease. This is one question. And another one is associated with Malassezia species. This is another question. Very, very important. Okay. Now, one thing, sebaceous glands are not inflamed, but they play a role in disease development. This is the third question. All right. These 3 points are very important when you are diagnosing seborrheic dermatitis and look at this image. You are done with a problem. Okay. Two causes are very important. One, it is associated with Parkinson. Second, associated with Malassezia species. Okay. Moving ahead. Common skin disorders. Each and every disorder is very important here. Okay. So let's just see them one by one. Acne, as you all know, inflammation of hair follicles and sebaceous gland. Okay, inflammation of hair follicles and sebaceous gland, you everyone know. So there is multifactorial etiology, increase in sebum androgen production, abnormal keratinocyte disformation. This is one important line. Cultibacterium acnes, colonization of pilosebaceous unit. This is the second point. And treatment is okay, avoid treatment. So what happens here is just write down one or two lines. They have given the term comedons over here. So what is comedon? Comedon. So comedons are debris blocking sebaceous duct. Okay, and this lipid-rich environment increases bacteria, which in turn is increase in use by wait used by bacteria, and the triglycerides are also used by bacteria. Okay, so these are what comedon says. Increase in sebum and keratin can also cause blockage. Okay, so these are the lines that have been asked in NBME and UL. So I hope you have come across this very soon. So this is what you need to remember about the acne. Okay, they won't focus on treatment part. So don't worry about the treatment part. Just focus on what are the different types of skin disorders and what important lines you need to remember. Okay, coming to second, atopic dermatitis, eczema. Eczema is one important. So it is a type 1 hypersensitivity. This is first point. Psoriatic eruption common on skin flexures. This is second point. And it is associated with other atopic disease. Atopic disease means asthma, allergy, rhinitis, food allergy, etc. This is third point. And increase in serum Ig, it is 4 point. Now here, they like to ask one funny question. Mutations in filaggrin gene. Okay. Skin barrier dysfunction. This is the fifth point that you will be remembering. Okay, filaggrin gene is very important. And what is the function of filaggrin gene is to maintain the skin barrier. Okay, so filaggrin gene में mutation है, the skin barrier dysfunction will occur, and that is what this is going to occur. Okay, so atopic dermatitis is all right. Moving ahead, allergic contact dermatitis, type 4 hypersensitivity reaction to contact allergen, nickel, poison ivy, neomycin. Now, how the question will be framed here? They will give either they will give first one belt, the belt, and belt में बीच में जो buckle बोलते हैं ना, the in the men's belt or even the women belt जो बीच में buckle होता है. Okay, so that can be one of the reasons of allergic contact dermatitis. So they will give you this case. This is very common. Second, no, okay, only this one. Second is urticaria. Okay, so belt wala is very common because this जो बकल होता है उसमें निकल होता है, and that is one of the reason why that allergic contact dermatitis occur. All right, moving ahead, melanocytic nevus. It is a common mole. Benign, but melanoma can arise in congenital or atypical moles. Intradermal nevi are papular. Junctional nevi are flat macules. The first point and second point. This is very important to remember. Intradermal and junctional, papular or macule. You have to remember this. Okay. All right. Moving ahead. Pseudofolliculitis barbae. So here you need to remember commonly occurs as a result of shaving. Okay. So अगर आपने घर पे like if you have seen your father or brother anyone who is shaving, so after sometimes there is some bumps appear on the neck. That is what known as pseudofolliculitis barbae, and in the question they will definitely give you after shaving. Okay. Psoriasis. This is very important. Very important. So make sure you know them properly. Papules and plaques with silver scaling. This is the first, especially knees and elbows. Acanthosis with parakeratotic scaling. Second, Munro microabscess, stratum spinosum increases, stratum granulosum decreases. This is third. Auspich sign, pinpoint bleeding spots from the exposure of dermal papillae when scales are scraped off. This is fourth. Okay, so these 4 points are very important for psoriasis. And you have seen the terms over here: acanthosis, parakeratosis, then stratum spinosum decrease, stratum granulosum. So all these terms, this is what I was telling you in the beginning. At least be familiar with the term, basic microscopic term. Okay. Next one, we have rosacea. We discussed कि facial flushing होगा in response to external stimuli, alcohol or heat. Okay, so rhinophyma mostly on the nose. And how to distinguish it from SLE? It won't be on the nose. SLE won't be on the nose. It will be on the cheek. That is in the butterfly pattern. Okay. Seborrheic keratosis. Always remember one thing: GIT cancer के साथ होता है. Let's just see flat, greasy, pigmented squamous epithelial proliferation of immature keratinocytes with keratin filled cysts. This is one important point. Lesions occur on head, trunk, and extremities. This is second important point. Lesser trellis sign that we saw. Okay, because of GI in the question. This is a third important point. So all these are very important. You will में सारे questions हैं. Okay, each and every line in this page that I have marked, it is a one question in UWorld. Okay, and you can expect the question in exam and in NBME also. Coming to varicose, not frequently asked, so you can actually avoid this. Coming to urticaria, hi, pruritic wills that form after mast cell degranulation, characterized by superficial dermal edema and lymphatic channel dilation. Now, one more thing I forgot over here. Though they don't ask varicose like individually, they will focus with the HPV strain. Okay, so it will be cauliflower-like papule. Alright, cauliflower-like papule, HPV stain, it occurs in anus or genital. ये तो आपको पता है. Okay, condyloma acuminans. So this is what all I was talking about. And one more thing, be thorough with the images in dermat. Okay, dermat is all about looking at the skin. So without looking at the skin, you won't be able to figure out anything. And this page is very, very high yield because each and every condition has been asked in UL with one line that I have marked here. So points जो मैंने आपको बताया है, please try to remember those points. In one of the cases I have already given in this allergic contact dermatitis. Yeah. Now another case that I want you to remember is uh, over here in urticaria. What they will give you in urticaria is वो होते हैं ना male using dye in their hair, or you can say hair color. This is for female also and male also. The hair color जो ऐसे यूज करते हैं ना, तो sometimes what happen is कि यहाँ पे करने के बाद there will be a purplish ऐसा पूरा एरिया में पर्पल पर्पल हो जाएगा. Okay, that is what urticaria is. So make sure you remember this. This is another case that they ask you in UL. Two questions are there. Okay, and या तो they will give you a case of a dyeing of hair. Second, they will give you the man is applying the hair color. Okay, so ये दो cases you need to remember it properly. All right, moving ahead. We have vascular tumors of the skin. Okay, let's just see them one by one. Angiosarcoma, it is rare and it is due to radiation therapy and chronic post-mastectomy lymphedema. Okay, no worries. Who is this? All right. So I was talking about we were talking about the vascular tumors of skin. So we know. So now see, they won't ask you anything like this. They won't give you anything like this. What they will say is, they will give you there was a skin tumor, skin sarcoma of the skin, and at the end they will give you a vinyl chloride and arsenic exposure. Okay. Remember in liver also we studied about hepatic angiosarcoma. It was also associated with vinyl chloride and arsenic exposure. Okay. If in the question they are giving vinyl chloride or arsenic exposure, think about angiosarcoma. Okay. Now coming to the second, that is bacillary angiomatosis. Okay, bacillary angiomatosis. Let's just see. Benign capillary skin papules found in patient with AIDS caused by Bartonella infection. Frequently mistaken for Kaposi sarcoma but has neutrophilic infiltrate. Okay, now let's just first do Kaposi sarcoma. Same thing is there. Same thing is going to be there. What is the difference over here is there will be lymphocytic infiltrate. Okay, lymphocytic infiltrate and it will be associated with HHV8 and HIV. Okay, herpes simplex virus 8. No, HHV8. Okay, so this is what you need to remember. Bacillary, it is a bacteria, so that of course it is going to be neutrophil. Kaposi sarcoma, it is occurred with it occurs with viral infection, so of course it is going to be lymphocyte. Okay, so just make sure you know the difference. Coming to cherry hemangioma, benign capillary hemangioma commonly appearing middle age, do not regress. Okay, benign capillary hemangioma. In cherry hemangioma, they won't give you any feature. They will directly show you the image. डायरेक्टली इमेज दिखा देंगे आपको पकड़ना आना चाहिए ओके कमिंग टू ग्लोमस ट्यूमर benign painful red blue tumor commonly under fingernails okay arises from modified smooth muscle cells of thermoregulatory glomus body. This is very important. Thermoregulatory glomus body is very important because they will say glomus tumor ho denge and you will have to find a diagnosis. After diagnosis they will ask you this type of cells are responsible for what function. You will say thermoregulation. Okay, glomus tumor is very important. Moving ahead, we have pyogenic granuloma. Myogenic granuloma, polypid lobulated capillary hemangioma that can ulcerate and bleed. Okay, ulcerate and bleeding दिखा रहे हैं तो it will be pyogenic granuloma. Strawberry hemangioma, benign capillary hemangioma of infancy appears in first 2 weeks of life, grows rapidly and regresses. This line is very important. Grows rapidly and regresses. This is very important. And here also they will give you the image. Okay, image देंगे and sometimes they will ask you the diagnosis or sometimes they will ask you which of the following is correct regarding this condition. So you will say it will regress spontaneously. You have to say that. Okay, so all these vascular tumors are also very high yield. One line. Okay, in this you just have to pick out one line and images. Moving ahead, we have skin infection. Okay, so skin infection basically we all will be covering with the microbiology. Okay, microbiology. But just one thing I want you to know, even if we are covering this with microbiology, I want you to be thorough with the images. Okay, you should be able to identify what are shingles. You should be able to identify whether it is occurring to Staph aureus or Streptococcus. Okay, so for that, let's just see 2 3 conditions here. Rest all we'll be seeing with the microbiology only. So in impetigo, let me see. Skin infection involving superficial epidermis. Superficial epidermis, usually from Staph aureus or pyogene, honey color crusting. Okay. Coming to erysipelas, infection involving upper dermis and superficial lymphatic. Step pyogenesis, present with well-defined raised demarcation between infected and normal skin. See, okay. You should just know these small things. Okay, dermis and superficial lymphatic, epidermis. If it is epidermis, you have to remember both can cause. If it is upper dermis, you have to think about pyogenesis. Okay, so think about this one line and one word that they have given in the question. Very important to know. Coming to cellulitis, acute painful. Now, if it is occurring by step aureus or step pyogenes, you should be picking out the term. If it is painful, it is cellulitis. Okay, it is deeper dermis and subcutaneous tissue. Can be done from both. Okay, That's it. These are the three things that I want you to remember properly because the differences will be asked between them. Like in the options में तीनों दिए रहेंगे. You have to figure out they are talking about impetigo, they are talking about cellulitis, or they are talking about erysipelas. Okay. That's all. We'll be doing this with microbiology. Okay. Just see the images and see what are they. Just see them. और कुछ नहीं करना आपको. All right. Moving ahead, cutaneous mycosis. ये माइक्रोबायो का पार्ट इधर डाल दिया. Okay. Let's just see. No problem. Cutaneous mycosis, tinea, clinical name for dermatophyte infection. Dermatophytes include microsporum, trichophoton, and epidermatome. Remember these names. They have septate hyphae visible on potassium hydroxide preparation with blue fungal stain. This is very important. Okay, actually it is a part of microbiology, mycology, but I am taking it here because it's already given. I will forget later. Okay, so tinea capitis, tinea corporis, tinea cruris, tinea pedis. Now, if we take into consideration regarding the tinea, not many questions are asked. Not many. I think UWorld also has one. Okay, UWorld has one. NBME hasn't asked anything. But you know what is the problem here is even if the UWorld hasn't asked any question related to tinea, the tinea continues to pops up in the question, in the option. Okay, so just go with it. No questions have been asked. Just remember this name from the last page, last name only. You can figure out the location of this infection. Okay. Now, yeah, even though this is not being asked, but this is Hyel, Tinea pityriasis versicolor. Let's just see what you need to remember here. Caused by Malassezia species, we saw Malassezia ahead, where seborrheic dermatitis. Okay, so this is what Malassezia is. Yeast-like fungus, degradation of lipid produce acids that inhibit tyrosinase, hypopigmentation, as well as hyperpigmentation. Okay, can occur any time of the year, but more common in summer, hot and humid. And yeah, important word for diagnosis is spaghetti and meatballs appearance on microscope. Treatment by selenium sulfide. All right. So all these are very important. This is what spaghetti and meatball appearance, hyperpigmentation, hypopigmentation, everything. Okay, so this becomes very important. Tinea pityriasis particular very important. But about tinea, just remember the last word and the name. That's it. All right. Moving ahead. Autoimmune blistering skin disorders. This is Hyel, Hyel, Hyel. Now see, you will be confused in the exam. Okay, because question will be easy. Question will be easy, but you will be confused. कि इसमें ये था या इसमें वो था. All right. Let's just see what is the problem. Coming to Pemphigus vulgaris and Bullous pemphigoid. Pemphigus vulgaris एक तो दोनों में पहले डिफरेंस पहला देख लेते हैं. IgG antibodies against desmoglein 1 or desmoglein 3 component of desmosome which connect keratinocytes in the stratum spinous. This is the first point of difference. IgG antibodies against hemidesmosome. Okay. Epidermal basement membrane antibodies are below. So this is the first point of difference that you need to remember. Okay. Another thing. Flaccid intraepidermal bullae caused by acantholysis. Tense blisters containing eosinophils. Okay, this is the second point. Now, third, oral mucosa is involved. Oral mucosa is spread. Fourth, Nikolsky positive, Nikolsky negative. Now, what is Nikolsky sign? Okay, let's just see. Skin slips off with gentle touch. Okay, skin slips off with gentle touch. If it is occurring, it is Nikolsky positive. If it's not occurring, it's Nikolsky negative. Okay, so these are the four differences that you need to remember. And the fifth one being the most important, reticular pattern around epidermal cells, linear pattern at epidermal dermal junction. Okay, so these are the differences, and mark my words, one or two questions are definitely going to come from this case. Okay, remember the differences. That's it. Both are type 2. This you need to remember. Both are type 2 hypersensitivity reaction. But I'll repeat again. IgG antibodies against desmosome. IgG antibodies against hemidesmosome. Flaccid intraepidermal bullae. Okay, flaccid. It will be like this. But here, tense blisters. You will see the fluid is filled inside the blister. See. Okay. Third, oral oral mucosa is involved. oral mucosa spread. Fourth, Nikolsky positive, Nikolsky negative. Alright, so this is what you need to remember here. This is okay, you can skip this. Moving ahead, other blistering skin disorders. Other blistering skin disorders is dermatitis herpetiformis is very important, and the most commonly they ask this with celiac disease. Okay, celiac disease के साथ आता है to deposits of IgA at the tips of dermal papillae. This is very important. Okay, erythema multiforme associated with infections, mycoplasma pneumoniae. Drugs are very important. Sulfur drug, beta lactam, and phenytoin. These are very important. Okay, present with multiple types of lesions, macule, papule. It can be anything. Looks like targets like multiple rings and dusty center showing epithelial disruption. This is very important. Erythema multiforme. This image is very commonly asked. Okay. Moving to the last part, Stevenson-Johnson syndrome characterized by fever, bulle formation, necrosis, slowing of skin at dermal epidermal junction. Nikolsky positive. Now see, Steven-Johnson syndrome, actually they don't ask directly. They will ask with what drugs are responsible for Steven-Johnson syndrome, and most commonly are the anti-epileptic drugs. First one, carbamazepine. Spelling, you can just check the spelling, okay? Carbamazepine. Second, etoxoximide. Etoxoximide is used in the absence seizures, okay? Lamotrigine and even PMX SMZ. This drug. Okay, so these are the most common causes of Stevenson-Johnson syndrome. Apart from this, there is another thing that you need to remember. Toxic epidermal necrolysis is more severe form of SGH involving greater than 30% body area. 10-30% denotes SG and TEN. Okay, तो 10% से कम होगा तो स्टीवन जॉनसन, 10 to 30% का हुआ तो SGH TEN and greater than 30% TEN. See this images. This is about TEN, toxic epidermal necrolysis. This is Steven Johnson syndrome. Okay, so images is very important when you are doing the math. Now this is a new thing that they have added here. It wasn't there in the old edition, but you will have 2-3 questions, and so the first state publisher decided to add venous ulcer, arterial ulcer, neuropathic ulcer. The main type of difference that you need to remember here is the first one is pain, mild to moderate, severe, and absent. Second, second was where this occurs, because based on the location you can easily diagnose it. Okay, this is going to be very difficult questions in the very difficult, it is going to be very difficult in the exam, and so based on the location you will be able to do it. Okay, the first one is ankle to middle calf hua to venous ulcer, distal toes, anterior chin and pressure points hua to arterial ulcer, and bony prominences, that is metatarsal head and heels hua to neuropathic ulcer. Okay, that's it. बाकी आप just देख सकते हो. You just have to identify which ulcer they are talking about. So venous में ये 2 point, arterial में ये 2 point, neuropathic में 2 point. That's it. Okay. Moving ahead. Miscellaneous skin disorders. Again, moving to the one-liners that we'll be doing here. Acanthosis nigricans. If in the exam they give you a case of diabetes or they give you obesity, okay, diabetes or obesity हुआ, straight away the question is talking to you about acanthosis nigricans. You can see the image, ऐसा ही image दे देंगे वो लोग. This is the armpit का part, but most commonly they will give you of the neck. Okay, so let's just see what is given here. Epidermal hyperplasia causing symmetric hyperpigmented thickening of skin, especially in axilla or on neck, associated with insulin resistant diabetes, obesity, Cushing syndrome, visceral malignancy. Okay, so diabetes, obesity most commonly as neck पे पूरा काला काला हो जाएगा. That is what acanthosis nigricans. Coming to actinic keratosis, pre-malignant lesions caused by sun exposure, small rough erythematous brownish papules or plaques. Risk of squamous cell carcinoma is proportional to the degree of epithelial dysplasia. Now, one important point over here: pre-malignant lesions caused by sun exposure. Okay, so how the question will come to you? I'll write it down. Pharma plus papules or macules, reddish, okay, on foreskin. Okay, so this is what the case is going to come to you. But sometimes along with this case, they will give you the image. Okay, and image में forehead ध्यान से देखने का. Look at the forehead properly. There will be red, small depositions, red deposition. If pharma is given, or if the patient comes, if the patient says that the profession is related to sun exposure, okay, think about actinic keratosis. All right. Moving ahead, erythema nodosum, painful raised inflammatory lesions of subcutaneous fat, paniculitis. This paniculitis, one question is there in UL. Okay, that's it. But can be associated with sarcoidosis and all those stuff, not necessary. Just remember paniculitis. Ichthyosis vulgaris. This is the new condition that they have added here. Disorder of keratinization resulting in diffuse scaling of skin, most commonly on the extensor side. Okay, so just ignore this. When you solve UL, just be thorough with that one question. Lichen planus, very important. Pruritic, purple, polygonal papules and plaques are the 6 P's of lichen planus. Very important. Mucosal involvement, Venicate as a Wickham's triad, very important, reticular white line, and hypercanelosis. Sawtooth infiltrate of lymphocyte dermal epidermal junction, and hepatitis C. See, everything is given over here. This is see papular, purple, everything. Okay, so this is what you need to remember. Sawtooth infiltrate, Wickham's triad, and all these 6 P's you need to remember. Okay, easily आएगा आपको बोल देंगे polygonal purple in color, it is pruritic, and what else can be seen. So you can say Wickham's triad or sawtooth infiltrate. Pityriasis rosea, herald patch, followed days later by other scaly epidermal plaque, often in Christmas tree distribution on trunk. Very important. So this one herald patch and second Christmas tree distribution. This is what herald patch is, and see Christmas tree distribution. Okay, easy to identify. Sunburn. Acute cutaneous inflammatory reaction due to excessive UV radiation causes DNA mutation. So UVB is the most dominant. Okay. So just remember it causes DNA mutation. That's it. All right. So with this, we are done this also. Now this condition, they won't be asking you separately. They will be associated with one or two other conditions. Okay. Acanthosis nigricans है, diabetes, Cushing syndrome, obesity. Actinic keratosis, it is a pre-malignant condition. It can cause common cell carcinoma. Okay. Erythema nodosum, fat का inflammation, paniculitis. Okay. Pityriasis rosea, lichen planus, and sunburn. They can ask this in, like individually, but rest all you need to be thorough कि किसी के भी साथ involve करके पूछ सकते हैं. All right. Moving ahead, burns. They don't especially ask burns, but you need to remember this. कि superficial partial thickness, deep partial thickness, and superficial burn में क्या क्या sensation है and what involvement is there. So I would recommend you to do this and keep this at a high yield because 2-3 questions were there in UL. Okay, UL में 2-3 question है, so just do this and yeah, actually you know, to be honest, do the entire table. Okay, do the entire table. It will benefit you because you know sometimes they will ask you superficial partial सारे ये options में दिए हैं and they ask you blisters है, does not blanch, blisters है, blanches with pressure. They will give you something like this. So this entire table is very important. Get it done. You can avoid this part. They haven't asked. Okay, so ये part avoid कर दो, but ये part definitely कर लो. Moving ahead, coming to the skin cancer. All right, skin cancer. So basically, you need to remember about the 2 types of skin cancer, basal and squamous. Okay. One simple rule: basal cell carcinoma more common above upper lip, squamous cell carcinoma more common below lower lip. Now you can see how you can remember. आपके लिप्स के शेप के हिसाब से आप देख सकते हो. ऊपर में ऐसे 2 पार्ट्स है, दैट इज बेसल, एंड बीच में एस है, नीचे एस है, कॉमन. ओके, सो रिमेंबर मोर 99% क्वेश्चन ऐसे ही सॉल्व हो जाएंगे. बिलो द लोअर लिप, ऑन द लोअर लिप, स्क्वामस सेल कार्सिनोमा, ऑन द अपर लिप, ऑन द नेजल लेबियल एरिया, बेसल सेल कार्सिनोमा. ओके, तो लेट्स जस्ट सी क्या क्या फीचर्स से आप आइडेंटिफाई कर सकते हो. मोस्ट कॉमन स्किन कैंसर फाउंड इन सन एक्सपोज एरिया ऑफ बॉडी, Waxy pink pearly nodules common with telangiectasia, rolled borders, central twisting or ulceration. See, this is very important. Waxy pink pearly nodules is very important. Okay. Next is basal cell tumors have palisading nuclei. Okay, palisading nuclei. This is what palisading nuclei. See देखो कितना alignment में, सब alignment में. Palisading nuclei. Everything is aligned. Okay, palisading nuclei. And another thing is about the lip, about the upper lip. Second thing is waxy pink pearly nodule. Okay, तो ये सब चीजें आपको याद रखनी है. Basal cell carcinoma. You can see waxy, pink, pink. Okay, so this is what you need to remember. Coming to kerato and acantoma. Middle-aged, older adults, rapidly growing resembles common cell carcinoma. Dome-shaped nodule with keratin fill center. This line is very important. Dome-shaped nodule with keratin fill center. Okay, and this is what it will look like. Dome-shaped or under keratin. Okay. Now first let's do squamous cell carcinoma. Second most common skin cancer associated with immunosuppression, chronic non-healing, etc. Marginal ulcer, that is HCC, arising in chronic wound or scar. Okay, this is important. Commonly appears on face, lower lip, ear, hand. Locally invasive may spread to lymph nodes, etc. Histopathology is keratin pulse. Okay. Now, whenever you are studying the squamous cell carcinoma or squamous cell tumors, you know they have to be keratin pulse present in them. Okay, keratin pulse का present होना जरूरी है whenever you hear the term squamous cell carcinoma. Okay, actinic keratosis we studied before. Now in the question they might ask you, uh, what are the two pre-malignant conditions before SCC? Okay, the first one is actinic keratosis, and second one is keratoacanthoma. Okay, keratoacanthoma ऊपर किया है यहाँ पे, and actinic keratosis we did here. This is what actinic keratosis is. Okay, so that's you need to remember properly. Now let's come to the last part of our cancer and last disease of our skin, melanoma. Common tumor with significant risk of metastasis. S100 is the tumor marker. And one important point I need you to remember here is look for ABCD. Asymmetry, body irregularity, color variation, diameter greater than 6, and evolution over time. This is what you need to remember. Okay. At least four different types of melanoma, including superficial, nodular, lentigo, and acral. See, they won't ask you, they won't give you the features of all of them, but they will give you the images. Okay, they will give you the images, and you need to figure out कि nodular है, superficial है, acral है, ये सब. Okay, so just be thorough with the images. Another thing, mutation in BRF kinase. Okay, and yeah, this is the drug ipilimumab. You can remember, and BRAF inhibitors vemurafenib. Okay, simple. Just डायरेक्ट क्वेश्चन आते हैं स्किन में. यू शुड बी एबल टू आइडेंटिफाई द इमेजेस. इमेजेस में आपको दे विल गिव यू अ पर्सन एट अ मेल और फीमेल एंड स्किन की लीजन दे देंगे वो लोग. ओके, वेरी इंपॉर्टेंट. डर्मेट इज ऑल अबाउट लुकिंग थ्रू मोर एंड मोर इमेजेस. क्वेश्चन सॉल्व करो, एक एक लाइन याद रखो, एंड यू आर गुड टू गो विद द डर्मेट. ओके, so with this we finish our dermatology, and now moving to the pharmacology of musculoskeletal system. So let's just see the first one. Now see, this diagram you can always use it for the reference. They have actually talk about the arachidonic acid metabolite. Okay, arachidonic acid metabolite है, leukotrienes है, फिर इसके उनके हिसाब से drugs है. Okay, so just give them a read, no problem. All right, so moving on, acetaminophen reversibly inhibits cyclooxygenase mostly in CNS, inactivated peripherally. Okay, this mechanism you have to remember. Antipyretic, analgesic, but not anti-inflammatory. This is very important line. First line, very important line. Antipyretic है, analgesic है, but anti-inflammatory नहीं है. Okay. So as we all know, Reye's syndrome it occurs because of aspirin toxicity in viral fever. So instead of aspirin, we give acetaminophen in viral fever and this Reye's syndrome. Okay. Overdose produces hepatic necrosis. Acetaminophen metabolite, that is NAPQI, depletes glutathione and form toxic tissue byproducts in the liver. And acetylcysteine is antidote regenerate. This is very important. Okay, I will mark this as high yield. You will maybe do सवाल है. NBME has asked so many of them. Okay, so I want you to remember. Now, one general point, if you want, you can write it down that I just thought during my preparation. COX-2, PGs that increase. PGs means prostaglandin, okay? First, pain sensitivity. Second, fever. Third, vascular permeability. So it will be vasodilation. And that's it. And if we talk about the COX-1, it is responsible for vasoconstriction. Okay. So this is the general information that I wrote it down during my preparation. You can also note it down if you want to. All right. Moving ahead, aspirin, one of the most important and the most common drug that we take. Okay. NSAID, that is irreversibly inhibits cyclooxygenase, both COX-1 and COX-2 by covalent acetylation, decreasing synthesis of tick, or everything is important. Okay. Everything is important over here. All right. Let's see. Low dose may decrease in platelet aggregation. Intermediate dose may act as an antipyretic and analgesic. High dose may it is anti-inflammatory. Okay, it is three of them: antipyretic, anti-inflammatory, anti-analgesic. Okay. Adverse effects very important here. The most commonly they ask about is gastric ulceration, tinnitus, and another thing that they ask about is acute kidney injury, that is interstitial nephritis. We did this in the interstitial nephritis, right? And another thing is risk of Reye syndrome. We already know. And treatment of overdose is by sodium bicarbonate. Okay. So all these line very important. Mechanism है, clinical use में यहाँ पे important है, because in exam I got one question, they give me the value, so I have to pick it out what how aspirin going to act. Okay. Coming to celecoxib, reversibly and selectively inhibits cyclooxygenase, which is found in inflammatory cells and everything. All you need to remember this. It spares COX-1, which helps in maintaining gastric mucosa. ओके. सो एस्पिरिन से अच्छा सेलिकॉक्सिब है, बिकॉज यहाँ पे गैस्ट्रिक प्रॉब्लम नहीं होता. ओके. इट स्पेस COX-1 thus does not have a corrosive effect or like this. Spares platelet function as thromboxane production is dependent on COX-1. तो प्लेटलेट फंक्शन भी बच जाता है, गैस्ट्रिक फंक्शन भी बच जाता है. ओके. वेर यूज rheumatoid arthritis or charter. No adverse effect, you can go. NSAID, remember the drugs, reversibly inhibit both block prostaglandin synthesis. Antibiotic, analgesic, anti-inflammatory. Indomethacin is used to close PDA. Very important. Okay. Patent ductus arteriosus, indomethacin देते हैं. Okay. Interstitial nephritis here also. Gastric ulcer here also. And renal ischemia. That's it. NSAID. Okay. Very commonly we have seen NSAID everywhere. Leflunomide. They haven't asked anything regarding this, but they have asked the mechanism. They have asked the mechanism. Okay. So make sure you know the mechanism. Bisphosphonate. Remember the name. Remember the mechanism. And how you will remember the mechanism? Just remember this point also. Bind hydroxyapatite in bone, inhibiting osteoclast activity. Very important. Used in osteoporosis, hypercalcemia, Paget disease, everywhere. Adverse effect is, this is very important, esophagitis. If taken orally, patients are advised to take water and remain upright for 30 minutes. Or else it will cause osteonecrosis of jaw and it will. This is very important. Okay. So I think one or two points are there. We did this in the endocrine. If you want, you can write it there only. Denosumab, monoclonal antibody, again rank L. Okay. Calcitonin, we did this in endocrine, directly inhibits osteoclast. Okay. So these are the two drugs you can study along as well. So you don't have to move the pages and go back. Okay. Next, teriparatide. Again here, they have asked the mechanism. Okay. So, and another important point is it also increases 1-alpha hydroxylase in kidney. Okay. So all these lines that I am writing down, they are part of your world. Okay. They are nothing new. Okay. Coming to the gout drug, we studied gout yesterday. It is a chronic and it is acute. So they will give you in the question the first line of treatment in acute drug, acute gout. First line of treatment in chronic gout. They will definitely give you in the question. You have to figure it out. Okay, so let's talk about the acute gout first. NSAID, any NSAID, use salicylate with caution. Okay, and what else you need to remember? Most commonly that is given is indomethacin. Okay, glucocorticoid can also be given, most commonly prednisolone. Now third, this is very important, colchicine. Bind and stabilize tubulin to inhibit microtubule polymerization, impairing neutrophil connectasis and degranulation. Very important. First point. GI neuromyopathic adverse effect. Second point. Can also cause myelosuppression and nephrotoxicity. Third point. Okay. So this is very important. This myelosuppression is very important because they might give you sometimes decrease in WBC. Okay, they might give you decrease in WBC. So you need to remember decrease in WBC बोला है, मतलब myelosuppression हुआ है. It means either colchicine is given, and you know yesterday, sorry, in the HEMAT we discussed many drugs that were associated with microtubule polymerization, vinca alkaloid, vincristin, and all those drugs. Okay, so they all have the common side effect. One is most common is myelosuppression, जहाँ पे आपके WBC कम हो जाएंगे. Okay, so this was all about the acute gout drug. Sorry, acute gout drug. Moving to the chronic gout drug. इसमें पहली बात तो आप ये याद रख लो, वन थिंग यू नीड टू रिमेंबर, मैकेनिज्म तो आपको सबके करना है. ओके, मैकेनिज्म तो सबके करना है. पेगलोटिकेज, फेबोक्सोस्टैट, probenecid. Okay, and apart from this, only in allopurinol you need to figure out one thing, that you won't be using allopurinol with azathioprine and 6 mg. That's it. That's it. You have to remember here, and this is what they have given. Just go through this. This is the purine metabolism that we saw in the starting of our classes. So this is what gout drugs are. Acute में सबसे पहले NSAID and colchicine you have to keep in mind, and chronic में the first one that we give is allopurinol, but make sure you don't give allopurinol with azathioprine. And ये सबके आपको mechanism आने ही चाहिए. So many questions have been asked. All right. Moving ahead, etanercept is very important here because you know mechanism to very important, but after all they give one more important line over here. And what is that line? इसमें नहीं दिया है actually. Yeah. So etanercept, yeah, they have given here decoy receptor. So in the question they will give you X as a decoy receptor. So don't get confused. Decoy receptor कहाँ पे भी आ रहा है? Think about etanercept. Okay. And these are the drugs, TNF alpha inhibitors, both are TNF alpha inhibitors. That's it. That's it. Okay. Imiquinod, remember the mechanism. Nothing else. Question INA, this is a new drug they have introduced. So that's it. Just remember the mechanism. All right. Then I think we are done with our musculoskeletal system. So Abhi, give me 2 minutes break, and we will start with the general pharmacology. I hope, no doubt in the musculoskeletal. I repeat again, one line or two line is enough to make the diagnosis in musculoskeletal system. Okay. So एंड मस्कुलस्केलेटल इज द स्कोर बूस्टिंग सिस्टम. इसमें आपका एक भी गलत नहीं होना चाहिए बिकॉज इसमें दिमाग लगाना ही नहीं है. यू डोंट हैव टू अप्लाई एनी ब्रेन, नो कॉन्सेप्ट, नथिंग. जस्ट रिमेंबर एंड सॉल्व द क्वेश्चन. रिमेंबर, वो लाइन ढूंढो, डायग्नोस करो. ओके, दैट्स इट. एंड नाउ we will start with general pharmacology. Just give me 5 minutes break. Alright, let's just begin. Pharmacology. इसमें ज़्यादा कुछ नहीं है. You have to remember few anticholinergic drugs, antiadrenergic drugs. That's it. And some general pharma concept are applied here. One thing I would like to tell you is कि ये जो enzyme kinetics है ना, I left this for the exam. Okay, I left this for the exam because I wasn't able to understand it to my full extent. फुल एक्सटेंट तक मुझे समझ में नहीं आया. अगर आपको समझ में आ रहा है, इफ यू आर एबल टू अंडरस्टैंड दिस, definitely do it because one or two questions will be asked. In my exam also, I got 2 to 3 questions, but I left it because I couldn't understand it. Okay, so 2 3 topics that you are not able to do because you're not able to understand them. Leave those topics. It's okay. It's okay to leave 2 3 topics. Okay. So as I wasn't able to do this topic, and the second one was the power wala in biostat that I already discussed with you. Okay, so these 2 3 topics I wasn't able to solve. मैंने छोड़ दिया. Okay, कितना ही फर्क पड़ेगा, 3 4 सवाल आएंगे छूट जाएंगे, पर बाकी सब तो you should focus on. Okay, so yes, remember this table very important, and if you're able to understand all of these relations, you are very important. Okay, I'm not saying this is not important. This is important. Okay, 2 3 questions will come in the exam. I don't know. I can't explain you this. So just do it by yourself, and ये table याद कर लेना. Okay. Moving ahead, bioavailability. Now, what they will give you is in the UL, many questions are there. They will give you that AUC oral, AUC IV. What we are calculating? We are calculating the bioavailability, and you should remember this formula. Oral ऊपर आता है, IV नीचे. Sorry, yeah, AUC oral ऊपर आएगा, AUC IV नीचे आएगा. Remember this formula. Okay, they will confuse you. Volume of distribution. Remember this table. They have given कि अगर low volume of distribution है, so कौन कौन से टाइप में ये दिखता है. ओके, फॉर्मूला आई डोंट सी एनी क्वेश्चन हैज बीन कम फॉर कैलकुलेशन ऑफ वॉल्यूम ऑफ डिस्ट्रीब्यूशन. स्टिल रिमेंबर इट. ओके, क्लियर एंड रिमेंबर द फॉर्मूला. half life, remember the formula, and one thing is remember this table. First half life 50%, second 30%, all those stuff. And yeah, one more thing they have asked in the NBME. In first order kinetics, a drug infused at a constant rate takes 4 to 5 half life. 4 to 5 half life is very important. Okay, it takes 3.3 half life to reach 90% to steady state level, and this is very important. NBME में ये question है. Okay, so make sure you know this. Dosage calculation, loading dose formula, maintenance dose formula. Important point here, in renal or liver dose disease, maintenance dose decrease and loading dose is usually unchanged. So these are small things, formula things that you need to remember. Exam में मेरे को एक भी calculation नहीं आया था. I haven't seen any calculation in NBME. UL में you might see 2 3 calculation formula. Okay. तो या just see this drug phase 1 में कौन से reactions होते हैं, phase 2 में कौन से reactions होते हैं. Zero order elimination. Remember the name of drugs. First order elimination. Just see this graph. First order में क्या difference आ रहा है, zero order में क्या difference आ रहा है. Okay, nothing is there like very important in general pharma, like it's a very small topic. You just have to focus more on anti-adrenergic and anticholinergic. That's it. ये सब आप छोड़ सकते हो अगर चाहो तो. Okay, I have done, I only left the kinetic वाला. Okay, that's all I did properly. Okay, but I am saying कि अगर आपको नहीं समझ में आ रहा है इसमें से कुछ भी, you can leave it. It's okay. Okay, now coming to over here, what did I do is yeah, weak acid का overdose होगा sodium bicarbonate से ठीक, and weak basis का it will be treated by sodium bicarbonate to overcome the sodium channel blocking and activity. Okay, that's it. You need to remember here. Yeah, this is very important. Okay, there is nothing to understand here. Just remember this efficacy and potency का curve कि किसका ज्यादा है, which is high potency, which is low potency, and sorry, high efficacy and low efficacy, high potency, low potency. Just remember this because in the question you will be given the graph, you will be given A, B, C, D, and you will be asked which drug is having high efficacy, which drug is having low efficacy, or which drug is having high efficacy and low potency. Something like that they will give you. Okay, so drug का position याद करना, this is very easy. Okay, receptor binding, and yeah, this entire table I would ask you to memorize it because they will give you competitive antagonist. So आपको पूछेंगे potential efficacy पे effect. नॉन कॉम्पिटेटिव में आपको पूछेंगे, क्लासेस में आपको पूछेंगे, एंड एग्जाम्पल दे विल गिव यू दिस ओनली. Okay, or sometimes what they will do, they will give you this graph, and then they will ask you what type of action is going here. So you will say non-competitive antagonist, and along with that they will ask you the potential efficacy का change बताओ. Okay, so this receptor binding वाला part, memorize this whole stuff. For sure one question is going to come from here. ये very easy है, just remember potency efficacy and you have to ratify all this stuff. Okay, therapeutic drug index बस आपको ये याद रखना है, measurement of drug safety, these 2 points, that's nothing else. Now drug effect modification. Okay, so as we see one of the effect, already we saw one of the effect, right? Symmetric synergetic effect, no, not synergetic, we saw the permissive effect, cortisol on corticolamine responsive. Okay, तो ये हमने देखा था endocrine में in the cortical part. Okay, so for just see the name, just understand the meaning, and yes, remember the examples को याद करना है. Okay, so mostly they won't ask this, but permissive का पूछते हैं, synergetic का पूछते हैं, additive का पूछते हैं. ये तीन का most commonly they ask. In NBME also questions are there, and you will definitely have them. Okay, तो just याद ही करना है, दिमाग कुछ नहीं लगाना है इसमें. Okay, and yeah, ये aspirin and clopidogrel most commonly asked. Aspirin, clopidogrel most commonly asked. Okay, autonomic receptors. Okay, before doing all this, let me just tell you which pages are extremely important. Everything is important. See, functions तो आपको पता ही होंगे, ठीक है? You must have studied in the early. This is the first chapter of sorry. This is the first chapter in the systemic pharmacology. Okay, if we keep the general pharmacology aside, I think this is the first chapter in the systemic pharmacology where you will be studying about the anticholinergic drugs and anti-androgenetic drugs. Okay, basically ये भी जनरल में कवर होते हैं, but functions तो आपको सबको पता है. Alpha 1, alpha 2, beta 1, beta 2, sympathetic system, parasympathetic system. You notice everything. Okay, so we won't be going into detail, and we won't have a debate over here. The main problem over here will be you won't be remembering this. Okay, you won't be remembering this, and questions are asked based on this. Okay, so ये आपको याद रखना है. And if you have access to sketchy videos, okay, if you have sketchy videos, I would highly recommend to at least do the general pharma के videos from this. General Pharm plus antibiotics, oh sorry, antimicrobials. ये दो चीजें, these two things, please do them from Sketchy Pharma. They have made this so beautiful. Rest of the pharma is not good, but this two category, General Pharma में ये सब anticholinergic, anti-adrenergic, and second antimicrobial. Very beautifully explained, easy to remember everything. Okay, see, this is one thing you can remember, and this flow chart. वेरी इंपॉर्टेंट, आई एम टेलिंग यू, वेरी इंपॉर्टेंट. मतलब पक्का 3-4 सवाल आएंगे. व्हाट दे विल आस्क इज प्रोटीन काइनेज सी, प्रोटीन काइनेज ए, इस पे कैसे क्या फर्क पड़ेगा, which will go through CAMP pathway, which will go through phospholipase C pathway, and you need to remember the receptors. Guys, I'm telling you again, remember this, very very important. पक्का सवाल आएंगे, and they will ask you कि अल्फा 1 M1 M3 ऐसा ऐसा है, तो आगे जाके कौन से पाथवे फॉलो करेगा. Instead of this, they might ask you the name of drug. You should remember this drug acts on what receptor. Based on the receptor, you will say that this drug will go towards the protein kinase A pathway or phospholipase C pathway or CAMP pathway. Okay, so please guys, ये बहुत ही important है. This page is extremely important. Why? Because of this receptors and this two path flow chart. Very important. बार बार देखते रहो, क्वेश्चन जब भी आएंगे बिना देखे सॉल्व करो. I am sure you will get to this. Okay, moving ahead, autonomic drug. Here you will be knowing the mechanism for sure. You will be knowing the mechanism. Let's not go into that. Let's just go over here. Focus over here. Because what they do is they will ask you A, B, C, D, E, F, G. What is going on? Okay. In your world you have seen 2-3 questions like this definitely. And in NBME also there are 2-3 questions. Okay. So general pharma is all about छोटी छोटी चीजें पे फोकस. जनरल लाइक वी डू जनरल पैथोलॉजी, सिमिलरली जनरल फार्मा भी आपको वैसे ही करनी है. ओके, मूविंग अहेड. See, these are the cholinomimetic drugs. I'm not going to tell you about the functions. I'm going to tell you what is important for the exam perspective. Okay? So functions तो आपको सबको पता ही है receptor की basis पे. But now here are a few important points that I would like you to remember. First one, yeah, you might be knowing about this drug, varenicline. It is used for smoking cessation. Okay, so यहाँ पे क्या होता है? It is muscarinic agonist to smoking cessation. Okay, remember this point. You will make सवाल था. Second, nicotinic receptors present in adrenal and skeletal muscles. Okay, and another thing is, yeah, these are the drugs. याद रखो and ये याद रखो. ओके, याद रखनी है. यू डोंट हैव एनी अदर ऑप्शन. मेटाकोलिन अस्थमा का उसमें ले, पिलोकार्पिन सिस्टिक फिब्रोसिस. Okay, so try to recollect when you are reading about each and every drug. Okay, coming to indirect agonist. Indirect agonist, these drugs are Alzheimer's. This drug is used for the screening of myasthenia gravis. नियोस्टिग्मिन जो है वो ट्रीटमेंट के लिए भी यूज हो सकता है. पीरियडोस्टिग्मिन कैन आल्सो बी यूज फॉर द ट्रीटमेंट. फिजोस्टिग्मिन इज यूज फॉर द एट्रोपिन ओवरडोज. ओके, तो ये सारी लाइनें आपको यूज करनी है. एंड अनदर थिंग इज, या, neostigmine has quaternary structure. Physostigmine also follows the quaternary structure. Okay. Moving on to anticholinergic poisoning. Now see, here they have given parathan, that is one. But another thing that can give you is melathan, ecothioclate. Okay. You have to remember this. Of course, you have to remember this. Nicotinic effects may okay, it is. But one important point I want to tell you, OP poisoning in old age can't be treated. Okay, so always look at the age. All right, that's it. That's it for OP poisoning. So see, that's all the information you have to do. This is the highlight that you I want you to focus more on. Okay, इसमें एक एक लाइन रीड करके कोई मतलब नहीं है. Everything you have to do over here. But these are the few points that I want you to focus on. Okay, coming to muscarinic antagonist. Muscarinic antagonist मैं लिख देता हूँ कौन सी रिसेप्टर पे एक्ट कर रहा है. M1, M3, M3, M1. Okay, so that's it. You need to remember everything. You need to remember. You don't have any option. Coming to atropine, ये आपको याद रखने हैं कि एट्रोपिन हर जगह कहाँ पे क्या करता है. ओके, दिस इज ऑल्सो वेरी इंपॉर्टेंट. तो जनरल फार्मा इंपॉर्टेंट है, बहुत इंपॉर्टेंट है. ओके, नाउ कमिंग टू सिम्पैथोमिमेटिक्स. सिम्पैथोमिमेटिक्स में यू माइट बी कंफ्यूज with one thing, in each and every drug they ask about SBP, DBP, MAP. Okay, I am repeating again. Please, if you have access to Sketchy, please do this. Okay, please करो. Sketchy ने बहुत अच्छे से समझा है, बहुत अच्छे से. Okay, and it becomes so easy to remember. I am telling you guys. Okay, कोई बात नहीं. Remember the applications, and now along with this, I will add few important parameters that you need to remember. Okay, so if the drug is if the question is about dobutamine, it will increase in SBP, that is systolic blood pressure. It will decrease in DBP, diastolic blood pressure. Increase in pulse pressure, decrease in systemic venous resistance. Okay, if they are asking about epinephrine, so there is decrease in DBP, decrease in MAP, decrease in SVR. Okay. If they are asking about the norepinephrine and phenylephrine, mostly they are going to be same. Increase in MAP, increase in SBP, increase in DBP, increase in SVR, increase in VR. VR is Venacetin. All right. So ये I am telling you again, sketchy का जुगाड़ निकालो and do this. Okay, do this. This is going to help you a lot. Okay, just give me a minute. All right. अगर sketchy का access नहीं है आपके पास, so I will give you one of the notes of sketchy that you can remember. Okay. So we will be studying two curves. Okay, three curves, 1, 2, and 3. So this is for those who are not having sketchy. Okay, if you have sketchy, I highly recommend please do this. तो ये पहला वाला कर्व होगा HBP, middle wala will be MAP, and third one will be DBP. Okay, sometimes it becomes difficult to remember the parameters directly. So let's just make it a curve. Okay, see ये तो this is what a normal curve is. Okay, straight line is a normal curve. आपको याद रखना है सबसे ऊपर वाला is HBP, second वाला is MAP, third वाला is DBP. Now doing one by one, we will go and do this. कर्व्स बनाएंगे तो कर्व्स बना के आप इजीली याद रख सकते हो. ओके, तो फिनाइल एफ्रिन का क्या कर्व होगा? एचबीपी इंक्रीज, एमएपी इंक्रीज, डीबीपी इंक्रीज. Okay, so this is how you are going to remember phenylephrine. Let's do for norepinephrine. As I told you, both are same. Increase, increase, increase. Okay. Now going to epinephrine. Epinephrine में क्या है? HBP increase, DBP decrease, and MAP increase. Okay. I'll make it again. HBP increase, MAP increase, DBP decrease. This is how you are going to remember the curves. Okay. फिर आते हैं आइसोप्रोटेनॉल पे भी आ जाते हैं. HBP नॉर्मल रहेगा, MAP and DBP डिक्रीज. नाउ कमिंग टू डोब्यूटामाइन. डोब्यूटामाइन में HBP इंक्रीज, MAP नॉर्मल, DBP डिक्रीज. ओके, तो सिंपल है. जस्ट ट्राई टू रिमेंबर द कर्व्स लाइक दिस. नॉर्मल में एवरीथिंग विल बी फ्लैट लाइन. ओके, एवरीथिंग विल बी फ्लैट लाइन. तो सबसे पहले HBP, MEP, DBP. बेस्ड ऑन दैट यू कैन रिमेंबर किसमें HBP बढ़ रहा है, किसमें DBP बढ़ रहा है, किसमें DBP कम हो रहा है, MEP कम हो रहा है. बिकॉज दे विल आस्क यू, डेफिनेटली दे आर गोइंग टू आस्क यू दिस. ओके, so that's it for this procedure. Sorry, that's it for this symptomatic mechanism and read. ओके, तो यही मैंने आपको उधर इजी करके बता दिया. तो यू कैन अवॉइड दिस पेज, अवॉइड दिस पेज. टाइम बचाया मैंने आपका. कमिंग टू सिम्पेटोलाइटिक्स, वेरी इंपॉर्टेंट. अगेन क्लोनिडिन. एंड योर इंपॉर्टेंट पॉइंट इज हाइपरटेंसिव अर्जेंसी एंड एडीएचजी में यूज होता है. ओके, दिस इज वेरी इंपॉर्टेंट. दे हैव आस्क्ड सो मेनी टाइम. अल्फा मिथाइल डोपा, प्रेगनेंसी हाइपरटेंशन. Tizanidine, release of toxicity, very important. These three drugs are very important. Coming to alpha blockers. Okay, alpha blockers functions तो आपको पता ही है. Phenoxybenzamin and phentolamine. Now here one thing I want you to remember is कि आपने पढ़ा कि हाइपरटेंसिव क्राइसिस होती है. हाइपरटेंसिव क्राइसिस में होता क्या है? What happens in hypertensive crisis? So it gets headache, there are palpitations and sweating. Okay. Now yeah, one more thing. Orthostatic hypertension, they will give you one case. The orthostatic hypertension, norepinephrine was given. Okay, so when norepinephrine is given, there is infection or rest, most commonly seen. Okay, infection and rest most commonly seen. Okay, now see, phenoxybenzamin may alpha 1 plus alpha 2, both receptors, it is non-selective. But non-selective, yes. But phentolamine mostly focus on alpha 1. Though it is non-selective, it can act on any, but it mostly focus on alpha 1. Okay. Now they are given alpha 1 selective, alpha 2 selective. Please guys remember the drugs and mechanism. I am telling you again and again. I'm telling you again and again because anti-adrenergic, anticholinergic, all you can do is remember the drug mechanism and understand that parasympathetic and sympathetic one. Okay, neither I am going to help you nor you yourself can't help you unless you are remembering it. Okay, let's go ahead. Beta blockers, आपको जानना ही है. Beta blockers, all drugs. Okay, just remember what they are. Just remember the non-selective and selective. How they have asked you, just see कि N से Z are non-selective and before that they are selective. Based on that, you can select them. Okay, give them a read. Not necessarily they will be asked, but when we do CVS, ये आपको सब clear हो जाएगा. Okay, moving ahead. Phosphodiesterase inhibitor, one of the most high yield questions that are asked. And important one is, let's just see, all of them are important. नॉन स्पेसिफिक में थियोफिलिन, मैकेनिज्म ऑफ एक्शन सब में ऑलमोस्ट सेम ही होगा. ओके, जीएमपी एंड एएमपी का खेल है, तो यू शुड अंडरस्टैंड द मैकेनिज्म कि जीएमपी कम हो रहा है, एएमपी कम हो रहा है, क्या हो रहा है. ओके, तो मैकेनिज्म तो याद रखना ही है. एंड हियर इट इज कार्डियोटॉक्सिक, थियोफिलिन कार्डियोटॉक्सिक, वेरी कॉमनली आस्क्ड. along with that, neurotoxic, very commonly asked. Okay, PD5 inhibitors, sildenafil, vardenafil, taldalafil, they are asked. So इसके साइड इफेक्ट भी बहुत कॉमन है. फेशियल फ्लशिंग, हेडेक, and another thing is, yeah, if the patient is taking sildenafil, there will be blue vision, cyanopia, there will be blue vision. Okay, so make sure a blue vision आता है क्वेश्चन में, यू वर्ल्ड में भी है. So PD5 inhibitors, PD4 roflumilast, not commonly asked. Milrinone, this is your acute decompensated heart failure with cardiogenic shock. This is asked. Okay. Platelet inhibitors, cilostatin and dipyridamole, intermittent claudication, TIA, cardiac stress testing, सब में use होता है. Here, cardiac stress testing is very important. Questions have been asked. UVL and BME. Okay. So nausea, headache, facial flushing, hypotension, abdominal pain. This is very important. Okay, so these are some of the points that I want you to really focus on. Whereas बाकी इसका mechanism और all sorts of drugs है, mechanism तो याद रखना ही है. Okay, moving ahead. Ingested seafood toxin. Now, I got this question, tetrodotoxin. Okay, I got this question, tetrodotoxin. So इसमें puffer fish important है. Now here you have to remember the mechanism. Okay, yeah, just give me a minute. I have an important call. All right. Sorry, I had an important call. Okay. So yeah, in exam I got this question, and NBME had this question also. Tetrodotoxin पे. They asked the mechanism. Okay. They asked that ये symptoms दिए थे, and it can be this also. ये भी हो सकता था, ये भी हो सकता था. But they mentioned puffer fish. Okay, they mentioned puffer fish. So you have to remember the fish also that they are taking. Okay, fish also you have to remember, and based on that their action will be different, and symptoms mostly common eye. All right, so ingested seafood toxins we are done, and this is the new topic that they have added here since the UL has started asking question. Okay, absorption unaffected, distribution decrease हो जाएगा, total body fat increase हो जाएगा. Okay, metabolism decrease हो जाएगा, execution decrease हो जाएगा. So it is important, ये आपको एरोज में आएंगे. ओके, बीएस क्राइटेरिया अवॉइड कर दो, कोई क्वेश्चन नहीं आते, डोंट वेस्ट योर टाइम. एंड या दिस आई वांट यू टू रिमेंबर. इसका प्रिंट आउट निकाल के अपने दरवाजे पे चिपका देना. ओके, स्पेसिफिक टॉक्सिसिटी ट्रीटमेंट, वेरी इंपॉर्टेंट. इट कम्स इन वेरी हैंडी बिकॉज आगे जाके व्हेन at the end time when you will be revising all the drugs, all the antidotes and everything, this is going to be very helpful. Okay, so with this we finish our general pharma. Okay, ये सब तो करके कोई मतलब नहीं है, क्योंकि all this you will be doing along with the system and that is what will help you more. इसको अभी रट के कोई मतलब नहीं है. Okay, so even I am not doing this. One important point I really love about this new update is they finally gave the cytochrome P450 interaction. Guys, इसको रट डालो. So many questions in NBME, in U World, so many questions. Just इसका भी प्रिंट आउट निकालो, डेली देखो. You can avoid the substrate, but inducers and inhibitors very 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 important. बहुत सारे क्वेश्चंस आए हैं. ओके, प्लीज. एंड ये प्यूपिल वाला जो है, वी विल डू दिस इन CNS ड्रग्स while we do the glaucoma drugs. And what else is? Yeah, that's it. Okay. With this, we finish our general pharma. I told you before, general pharma में इतना कुछ नहीं है. You just have to focus on your basic pharmacology, mechanism, and what are the actions. यहाँ पे तो side effect का भी इतना फंडा नहीं. Okay. One thing you must have faced problem was in the symptomatic, that SBP, DBP वो वाला सब. तो वो मैंने आपको easy कर दिया. I made it easy for you by remembering the curves. Okay. And what else was there is toxicity wala. Then phosphodiesterase inhibitors. Yeah, another thing that G couple protein receptors QISS जो receptors है वो, उसके नीचे के दो pathway CAMP, phosphokinase A, protein kinase A, phospholipase C. That pathway is very important along with the receptors. Definitely questions have been asked. Okay, so that's it from my side. We are done with general pharm and we are done with dermat. So in total we finished musculoskeletal. जनरल में अपने सारे हो गए. नाउ वी आर पेंडिंग विद CNS, CVS एंड reproductive part. Okay, tomorrow no class. Saturday, Sunday I will finish CNS. Monday I'll try to finish the entire CVS, and Tuesday and Wednesday I'll take for reproductive. So by Wednesday we will wind up our course. Okay, so आज का class, it was really very small. It's okay if you did not attend. 1x पे 2x पे देख लेना. And that's it. I take your leave and see you for the next class. We will be doing CNS. आ जाना CNS में. Okay, that's it.